In this episode of the Mel Robbins podcast, Dr. Sarah Wakeman, a renowned medical expert in the field of substance use disorder, discusses the impact of alcohol on the body, brain, and overall health. Alcohol is a water-soluble molecule that is readily absorbed in the body through the stomach and small intestine. It affects various body systems, particularly the brain, leading to changes in behavior, sleep, mood, and other functions. Alcohol consumption can have negative impacts on health, including an increased risk of cancer, liver damage, kidney issues, and changes in the gut microbiome. Studies have shown a link between alcohol consumption and liver failure, with a significant increase in alcohol-related liver disease among younger individuals, particularly women. Alcohol can also affect the kidneys by making them less sensitive to antidiuretic hormone, leading to increased urination and dehydration. The gut microbiome can be impacted by alcohol consumption, causing changes in gut permeability and microbiome composition. While some studies have suggested health benefits of moderate alcohol consumption, Dr. Wakeman advises against viewing alcohol as a health-promoting behavior. Instead, she emphasizes the importance of understanding individual risks and goals related to alcohol consumption. Alcohol can worsen acid reflux, dehydrate the body, disrupt sleep patterns, and affect mood and skin health. Dr. Wakeman highlights that quitting or reducing alcohol consumption can lead to better sleep, weight loss, improved exercise capacity, enhanced mood, and healthier skin. Alcohol can also exacerbate symptoms of menopause, such as hot flashes, sleep disturbances, and mood changes. Dr. Wakeman advises against alcohol consumption for individuals experiencing menopausal symptoms. While alcohol may help individuals fall asleep faster, it disrupts sleep architecture, leading to less restorative sleep. This can result in waking up in the middle of the night or feeling unrefreshed in the morning. Alcohol also affects the brain's ability to form new memories and can lead to memory impairment over time. Chronic heavy alcohol use can even result in permanent brain damage and memory loss. Hangovers are caused by dehydration and toxic byproducts of alcohol consumption. Anxiety during a hangover may be attributed to the impact of these byproducts on the brain and hormones. Mixing alcohol with medications for anxiety or depression can be dangerous, as it can amplify the effects of the medication and lead to adverse outcomes. It is crucial to avoid combining alcohol with certain medications to prevent harmful interactions. Higher risk drinking is defined as consuming more than 10 ounces of hard alcohol or 35 ounces of wine per week. It is essential to be mindful of serving sizes and be honest with healthcare providers about alcohol consumption to accurately assess health risks. Dr. Wakeman encourages individuals to evaluate their relationship with alcohol and consider making changes if it is impacting their overall health and well-being. Taking a break from alcohol, cutting back on consumption, or exploring healthier coping mechanisms for stress can help individuals reassess their habits and make informed decisions about alcohol use. Dr. Wakeman explains that alcohol use disorder is characterized by drinking more than intended, unsuccessful attempts to cut back or stop, drinking despite negative consequences, and experiencing cravings for alcohol. She also mentions physical symptoms, such as needing more alcohol to achieve the same effects and feeling sick when not drinking. It often stems from underlying issues, such as trauma, anxiety, and depression. Dr. Wakeman explains that alcohol can become a coping mechanism for dealing with stress or other emotional challenges. She highlights the importance of addressing these underlying issues in conjunction with treating the alcohol use disorder. Dr. Wakeman challenges common misconceptions about alcohol use disorder, such as the ideas of tough love, enabling, and hitting rock bottom. She emphasizes that shaming or punishing individuals with alcohol use disorder is not effective in promoting recovery. Instead, she advocates for a compassionate and supportive approach that focuses on understanding the individual's motivations for change. For individuals concerned about a loved one's drinking habits, Dr. Wakeman advises approaching the conversation with empathy and understanding. Expressing care and concern without judgment can help open up a dialogue about the issue. It is essential to listen to the individual's perspective and work together to identify their goals and motivations for change. Providing support and encouragement can empower the person to seek help and make positive changes. Dr. Wakeman offers practical advice for initiating conversations about alcohol use with college-age individuals or young adults. She suggests starting early and having open, non-judgmental discussions about the risks and consequences of heavy drinking. By creating a safe and supportive environment, parents and caregivers can help young adults make informed decisions about their alcohol consumption. For individuals looking to cut back on their alcohol consumption, Dr. Wakeman recommends setting specific, measurable goals and identifying personal motivations for change. Keeping a drinking diary can help track patterns and triggers related to alcohol use. It is essential to create a plan for reducing alcohol intake and to enlist the support of friends and family in achieving these goals. Dr. Wakeman acknowledges that changing drinking habits can be challenging, especially when faced with social pressures or lack of support. She encourages individuals to communicate their intentions and goals to those around them, seeking understanding and assistance in making positive changes. If faced with unsupportive relationships, it may be necessary to reassess the role of those individuals in one's life and prioritize self-care and well-being. In closing, Dr. Wakeman offers a message of hope to individuals struggling with alcohol use disorder. She emphasizes that treatment works and that recovery is possible with the right support and resources. For those receiving feedback or concerns about their drinking habits, she encourages viewing it as an expression of love and care rather than judgment. By seeking help and making positive changes, individuals can work towards a healthier and more fulfilling life.